student Dr. Answer. I'm a student at Barry University.
Oh,
How are
hi.
you?
Good. I'm Krista.
Nice to meet you. So, what brings you in today?
Well, I've been experiencing some really uncomfortable pain in my right foot, and I just couldn't handle it anymore, so I decided to come in.
Okay.
Like I almost toppled over because of it the other day. So.
Oh, okay. Did anything happen that made it start hurting, or was it just kind of a gradual onset? Or?
No, it kind of gradually happened. It's been going on for about like 3 weeks now or so, three or four. Nothing major happened. Like I didn't drop anything on it.
Oh, okay. So can you point to exactly where it hurts? Just like if you had to use only one finger, where would you?
I would say it's right here.
Right here? Does that hurt when I push
A little more towards the heel.
Right here?
Yeah.
Okay.
Mm-hmm.
Okay, great.
Yeah, it kind of hurts.
So when the pain is happening, how long does it last?
Well, it's kind of one of those where it lasts you the whole day. In the morning, it really hurts a lot. I'd say it's probably like really sharp in the morning, and then like when I'm walking throughout the day and whatnot, it gets a little better. Resting it helps me, but I obviously can't do that all day every day. So.
Okay, and then how long has this been going on?
About like 3-4 weeks.
3-4 weeks. Okay. And would you describe it as like a sharp pain or kind of a more dull pain, throbbing pain? How would you describe it?
It's definitely more of a sharp pain in the mornings, and then it kind of progresses to like a more like throbbing pain. Like I know it's there all the time. But definitely sharp. It's pretty often.
Okay. And does anything like aggravate it or leave it?
When I'm sitting down, it really helps. But if I'm sitting down for a while or laying down for a good amount of time, or I went to bed or something, standing up right after that hurts. So I guess like walking on it.
Okay. Does it start hurting like when you first start walking on it, or after a while, like you've been walking on it?
When I first start walking on it, it hurts. Then after a while, it gets a little better. Like it's almost like I get used to it.
Okay. So does the pain just stay right here where you pointed to, or does it kind of go anywhere else?
It like spreads out throughout the whole bottom and like goes up. Like lately, I've kind of started feeling it going more towards my calf too.
Okay.
So it's.
Does it go all the way up your calf, or does it just kind of stay down here?
No, it stays more down there, but it hasn't. Yeah. It hasn't gone up.
Okay. Has it been getting worse since 3 weeks ago, 3-4 weeks ago, or is it getting better? Or
I'd say it's getting worse.
It's getting worse. Okay. And does this cause you any sort of disability at all?
I mean, no. I still go to work and whatnot. I mean, I can go to the grocery store. Just I can't wear like dress shoes as much because it doesn't feel nice. I try not to like walk as much because it doesn't feel great.
Okay. What I'm going to do is I'm going to ask you a little bit more about your past medical history, so that way I can get a better idea of kind of the lifestyle that you lead and everything like that. It helps me get a fuller picture.
Yeah.
So have you ever had any past hospitalizations or surgeries?
No.
Okay. What about any serious illnesses maybe in your childhood or?
No, nothing I can recall, no.
Okay. And none in your adult life either?
No, yeah. Okay. I've just been pretty healthy.
Okay. Have you gotten caught up on all your immunizations? You have all the typical ones?
All the typical ones. Like your need for school and whatnot.
Okay, perfect. Are you taking any medications?
No.
What about any allergies?
Just to Compazine.
Compazine, okay. What about any transfusions at all?
Nope.
And this is going to sound like kind of a silly question, but do you know who the president is?
Yeah, Donald Trump.
Okay. And how would you say you're feeling today? Are you, like, emotionally, are you
I feel fine, yeah. Okay. No complaints.
Okay. So what do you say that you do for work?
I'm a dentist.
Oh, okay. Does that allow you to get enough sleep, or do you have to stay up sometimes?
Yeah, I mean, sometimes you have to wake up for earlier cases or like some sort of an emergency, but it's rare. You tend to get around 6 hours a night.
Okay, and do you feel like that's enough?
Yeah, I'd say so.
Okay. What about any smoking at all?
Nope.
What about, this is going to seem kind of a personal question, but it's like a routine I just have to ask everybody, and it helps me get a better idea. Are you sexually active?
Yes.
Okay. Is it with a steady boyfriend? Or?
Yeah, I've had a boyfriend for a year.
Okay. Does that mean you're not married?
No.
Okay. Do you get to exercise with your busy schedule?
Yeah, my boyfriend and I will go to the gym around like 5 times a week.
Oh,
try
that's
to.
Nice. Yeah.
Yeah.
It's good that you guys like to work out together.
He motivates me, otherwise I just won't get around to it.
So what about your diet? Is that something that you try and keep on top of as well?
Yeah,
okay.
Definitely more salads and smoothies and whatnot.
Okay. Do you drink at all?
Just socially, like if we go out with friends, or I'll have a glass of wine here and there.
Okay. What about any sort of drugs? Prescription, illicit drugs?
No. Definitely not.
Okay. What about any pets?
No pets.
Okay. And do you and your boyfriend travel, or do you travel for work or anything like that?
Not recently, no.
Okay. What about your immediate family, like your parents, your siblings, grandparents? Do they have any major medical issues?
No, thank goodness everyone's healthy and alive.
Okay. So what I'm going to do now is I'm going to do just a general physical, just to make sure everything checks out.
Okay.
So that way we can see if there's any sort of issues with that. Is that?
Yeah, that sounds good.
Okay, great. So tell me if I hurt anything when I'm doing this.
No.
Everything feels fine?
Everything feels fine.
Okay. Have you noticed any sort of like spots or like sores or anything on the back of your legs?
No.
Like that? Okay. It feels like your skin is fine. It doesn't seem dry or anything like that. Your toes don't have any macerations, which is great. You seem to have a little bit of a hyperkeratinized lesion on your second metatarsal.
Okay.
Just right here.
Yeah.
Same thing for this foot.
Okay.
I don't see any open wounds. Do you have any blisters or anything like that you remember getting?
No, lately I've been wearing my sneakers more, so no blisters.
Okay, and I don't see any lesions or anything either. Your pigmentation looks fine even throughout, and your toenail polish is very pretty.
Thank you.
Mm-hmm. Do you do them yourself?
Yeah.
But from what I can see, your nails look normal as well. Normal thickness, normal color from what I can see.
Great.
Okay. And your posterior tibial pulses are great, 2 out of 4. Same with your dorsalis pedis. I'm going to check your popliteal pulse just to make sure. So I'm going to have you flex really quick. And that feels normal as well, 2 out of 4. And same for this one, 2 out of 4. Great, so your pulses are awesome. I'm not feeling any temperature change, warm to warm. Okay. Your hair growth is normal, which is great. And your skin turgor looks great. And your cap refill is all under 3 seconds. I don't see any swelling or edema, and I don't see any signs of venous issues like spider veins or varicose veins or anything like that. So now what I'm going to do is I'm going to do the neurological test.
Okay.
And so we have this thing, it's called a monofilament. It's just fishing wire. Do you want to feel it? So it doesn't hurt.
Oh, okay. Yeah.
And so what I'm going to do is I'm going to have you close your eyes and just tell me yes if you can feel it.
Gotcha. Yes. 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 Yes.
Okay, great. So now what I'm going to do is I am going to just test your reflexes. So if you can scoot out a little bit. Okay. 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 So now what I'm going to do is I'm going to have you scoot back a little bit again. And I'm going to need you to tell me, we're going to do kind of something similar to the monofilament, except for I'm going to use something that's dull, which feels like this, and something sharp that feels like this.
All right.
So So I won't poke you or anything like that. If it really hurts, just tell me and I'll stop.
Definitely. Oh, you'll know.
Okay, so just close your eyes, and if you feel something, tell me if you think it's sharp or if it's dull.
Okay. Sharp. Sharp.
Sorry.
Dull. 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 Sharp. Sharp. Dull.
Okay, great. Okay, so now I'm going to see if you can feel your vibratory senses.
Okay.
So
Can I
just
close
tell
my eyes again?
Yeah, so just close your eyes and you'll feel it vibrate. So when you feel it vibrate, tell me that you feel it. And then I'm going to stop it and just tell me when you think it stopped.
You got it.
Okay.
I feel it. And it stopped. I feel it. Stopped. Feel it. Stop. Feel it. Stopped.
Okay, great. Okay, so now what I'm going to do is I'm going to have you close your eyes again. And I'm going to move one of your toes and you just tell me if it's pointing up or if it's pointing down.
Okay. Big toe down.
Okay.
Little toe up.
Mm-hmm.
Third toe up.
Okay.
Second toe down.
Okay, great. So now what I'm going to do is I'm going to just do your reflexes on your feet.
Okay.
You don't have to do anything for this one. Okay. Okay. Great. Okay. So now what I'm going to do, I'm going to do your muscular exam.
Mm-hmm.
So I need you to pull your feet towards you.
Okay.
As hard as you can. Good job. Now push down like you're pushing on a gas pedal. Great. Now push them out. And make my hands clap. Good job. Okay. So one more thing. I'm going to put your foot in neutral and then I'm going to try and move your foot so that way I can see how much dorsiflexion you have.
Okay.
If it hurts, like 'cause I know this foot hurts, just tell me and I'll stop, okay?
Gotcha.
All right. Okay. A little tight there.
Yeah.
Do you stretch?
I
after
do.
Okay.
Yeah. My Achilles tendon has always been tight since I was a kid. So.
All right. I'm gonna try and bend your foot now, so that way you can see which muscle it is.
Still
Okay.
tight.
Yeah.
I don't feel any pain with them, but yeah, it's tight.
Okay. Okay. So this one I know this is sensitive, so just let me know if it hurts. Okay.
Yeah. Yep. That's fine.
Okay. Okay. I'm gonna do the same thing on this guy. Okay. All right. Great. That's all I've got. I'm gonna run and talk to my attending, and we're gonna figure something out. Come back and see how we can help you. Okay.
Great. Thank you
Thanks.
so much.